Ladies and gentlemen, welcome to our third medical live Zoom webinar on COVID-19. Good afternoon. I'm sure the majority of you know me. I'm Seta Bogosian, GP Principal, Surrey Heartland CCG, and also Senior Advisory Clinician on COVID-19 services. I'm also honored to be a chairperson of AMA-GB, Armenian Medical Association, Great Britain. Thank you for everyone participating and sending us questions and joining our webinar today. As last week, I'm sure you're all aware, it was Mental Health Awareness Week. And as our COVID-19 lockdown is gradually easing, and because today is our Armenian Church Feast of Pentecost, so we decided to do this webinar on mental health and psychological well-being. So before I start, I would like to introduce our panel, which is two specialist speakers. Dr. Anna Savagian, she is a specialist child psychologist, an honorary senior lecturer at Guy St. Thomas's, and an honorary research fellow at King's College. And also Dr. Vahag Davitian, who is consultant adult psychiatrist, who a few months ago decided to desert us and move to sunny Brittany to start enjoying his retirement. However, he remained very sincere and our invitation to join the panel today. Before we start, I just want to make state few remarks or what's happening here in England in primary care on the community in regard to psychological and mental health. I would like to remind everybody that COVID-19 is just like flu-like illness, and 90% of cases we manage them in general practice. Very small proportion get admitted to hospital, and very small percentage of those admitted to hospital get admitted to intensive care unit, and very, very small percentage, unfortunately, they passed away. However, the majority also people, they have the virus without noticing it. From our previous experience and previous reports in the journal showed that there is significant adverse effect of major crises and disasters like war or earthquake and disease pandemic on population's mental health. We know various factors like political, economic, social, technological, legal, environmental, and also health care factors are the key determinant of the society. And currently, COVID-19 affecting all those factors. And currently we are facing tremendous challenges, especially in mental health while we are recovering or coming out from this major threat. But this is a wake-up call for us. The prevalence of mental health issue is expecting to grow enormously in the future. And that's due to various repercussions of the virus on the lockup and also on various aspects of the personal well-being. We are already seeing a rise in urgent and emergency cases, including those who had suicidal thoughts or were self-harming. At the same time, significant drop in routine appointments for mental health. Unfortunately, also, they're not turning up for reviews or medication requests. We are also aware and worried about the people who really need help at this stage now, but are not getting it due to lack of physical contact, physical face-to-face or group therapy, where we normally used to practice in general practice and community. We are worried that this lockdown is storing various problems in human or mental health well-being, and we will be having tremendous rocketing of referrals like tsunamis or rush of referrals soon. And we should take people's well-being seriously in order to avoid long-term social and economic costs to the society. So the mental health should and hopefully will be our government investment core element of response to COVID-19 pandemic to cope with this predicted surge of cases and after lockdown. And the government is now looking to bring specialist skill into mental health support team for intensive care assessment, trying to recruit specialists in nursing, specialist nursing, psychotherapists, nutritionists, neurocognitive, neuropsychiatric, and rehabilitation specialists. And this message is for our junior graduates who would like to pursue a career in mental health or in psychological services. So I'm sure you all have all heard that also alcohol sale has rocketing up in our supermarket. And the consumption is gone up during this pandemic. And as we are coming out of this wave, we will be seeing considerable number of referral alcohol-related problems. So this is another service which is going to be hot soon. And similarly, the calls from vulnerable children to Children's Support Helpline, it's rocketing up to duplicating, if not triplicating, in the last 2-3 months. And as the school is starting tomorrow for certain age group, so the children's mental health will be a significant problem, which Annie is going to talk lots more about it in a few minutes. And currently, government is providing mental health support and counseling services in every school, hopefully. So Annie will elaborate more about this. And one more point I would like to say before I stop is domestic violence is again another issue which we'll be seeing, and also relating to mental health and psychological well-being, as the calls from police from vulnerable women is also increasing. But this is an issue or subject which we will be talking again, well, hopefully soon in our future webinars. Okay, so I think it's a time to start, but before we start, I would just like to make a disclamation that what we are expressing today, we have no competing or any financial interest. All our speakers have got no any conflict of interest. And everything we are seeing today is our opinion, or rather than our employers' views. And also the information we are providing are the best we have learned so far to date. Okay, I now open the platform to our panelists. We start with Dr. Annie Osvajian to start tackling the questions which I have received on children's well-being. Annie, would you like to take the questions, and then Bahag will join.
Okay, so question one was, how should I communicate with my 7-year-old daughter during this pandemic regarding the physical distancing and self-isolation, sorry, without inducing anxiety? And of course, my voice has gone right now. I'm just going to crack on. I think this is an incredibly important question. So this outbreak has affected every individual, every generation, every society in so many different ways. And there'll be very few people who haven't been affected in some way by anxiety, whether it's in regards to their health or their family's health, their finances, or in countless other ways. So the difference for younger children, though, is that they might not have, well, they don't have that same prior knowledge that adults do. So with which we use to put the current events in context. So we know that social distancing, self-isolation, etc., they're likely to be temporary measures, and that natural human behaviours such as close proximity, touching, hugs, handshakes, etc., they're all part of normal life. and in other times, nothing to worry about. So it's really important to explain to children in developmentally appropriate terms that these are measures in place to stop the virus spreading, that everyone has a part to play, and that together with the work the government and scientists are doing, things are getting better. It's important that children understand that this pandemic is a out of the ordinary event. Even for most adults, we haven't seen this in our lifetimes, but with the appropriate measures, we don't need to be afraid, and that things are already getting much better because science is so much better than it used to be. And it's also important to recognise, of course, that adults are also experiencing anxiety. And there's a balance to be struck here between conveying that anxiety is a normal emotion without creating unnecessary anxiety in children. So all the advice, keeping a calm tone of voice, be honest about what you know and don't know. Above all, listen to children's concerns, and that means really active listening. So validation is a very psychology sort of word, but it is really important to validate children's worries and not dismiss them, and let your child know that you're there for them if they have any questions. And a term that's been used a lot is the new normal, but it's become very apparent that there is no new normal. Things just keep changing, and we simply don't know yet whether some of the changes to society will be permanent or whether we'll just return to life as it was. So one thing that's also really important to stress is that there are some questions that we just don't have the answer to, but that's okay. Intolerance of uncertainty is a psychological mechanism which has been implicated in many anxiety disorders and in fact a range of mental health problems. And usually our lives are quite predictable to a greater or lesser degree, but this has really thrown uncertainty into the mix in a big way for all of us. So again, it's important to be honest about what we know, what we don't know. Don't try and answer questions you don't know the answer to, as this can erode trust. And just communicate to your children that uncertainty is okay. And doing this visually may be helpful. So, for example, drawing out a timeline of what happened, what's happening now, the things that we know will happen. For example, schools will open, the things that we don't know, like when they're going to open, for whom. So it's important to be mindful also of what information children are exposed to, because there's a lot of misinformation out there, and it's incumbent on adults to convey information from reputable sources only. And generally, for both children and adults, limiting exposure to the news is no bad thing, I think, for anxiety management in general. So that's what I have to say for question one. I don't know if Vahag wanted to say anything or whether he wants to go on to his next question.
Possibly we can go to the next question, because there are some issues which are common between children and adults. So possibly I may mention some few more points later on.
Okay.
So would you like to read your question, Vahag, your question number 6? And answer it, please? Or shall I read it?
Yeah, yes, please.
I feel I'm becoming extraordinarily anxious recently, worried about catching COVID-19. When should I draw a line and start to seek help? Worrying that this might become pathological.
Okay. In general, anxiety is one of the main features of COVID-19, and anxiety could happen to anyone. So generally, population are anxious. The population could be anxious, but it is a good question when it becomes pathological. Anxiety is part of every personality, and anxiety in general is helpful for us to live our everyday life. But when it becomes pathological, it will have negative impact on our daily functioning and daily life. And that is really where we can know if anxiety is helping us or hindering our functioning. If we feel that we are having a lot of anxiety, which stopping us from doing our daily activities, concentrating upon what we usually concentrate on, or it is stopping us from sleeping well, sleeping enough, or affecting the level of our functioning. It means that the anxiety is beyond its limits, beyond its helpful limits. Right? So that is something very, very important, that if we feel we are not able to live our normal daily life as before because of anxiety, it means this is the beginning of the anxiety becoming a pathological issue. And that is where we need to seek help. But there is something important that I would like to insist on is, if we feel that we are overwhelmed with our anxiety, and in the past we had that and we learned measures to deal with it, it's good to apply the measures that worked in the past in terms of using different techniques, relaxation, occupying ourselves by things that we used to enjoy, trying to have to maintain our daily routine and continue doing what we are able to do.
Good. Okay, thank you. Thank you, Vahak. Can we go into next question in children's, Annie? Would you like to just jump in, please?
Sure. So the question is, what should I observe in my vulnerable child with autism and learning difficulties to safeguard him during the fear of this pandemic? Another great question. So I specialise in autism, and this pandemic has really highlighted what we've all known for a long time, and that is that many aspects of daily life, especially those involving human interaction, can be extremely stressful for young people with autism. So interestingly, among many of my clients, and a lot of my colleagues have said the same thing, anxiety rates have gone right down since the schools shut due to the reduced pressure to interact socially, conform to other people's agendas, etc., etc. But for some young people, the loss of contact with support services and also the change in routine has been very challenging. So many people have quickly established a new routine, which has worked really well for some people. But the challenges of being in confinement may be greater for those who need regular exercise opportunities. So, for example, those with co-occurring ADHD, or those who need outdoor activities to assist with emotion regulation. So thankfully, the rules have relaxed a bit in this regard. So signs of anxiety and or low mood in autism and intellectual disability, but particularly in autism, might include an increase in repetitive or stereotype behaviours, increased social withdrawal, and an increase in sensory seeking behaviours, as well as more typical signs of anxiety or depression, such as increased motor agitation, teariness, or anhedonia, which refers to the loss of enjoyment of activity. And as I mentioned, having a routine at home may really help, as might also some sensory activities to help your child with emotion regulation. And these might be highly individual. So, for example, some people like being squeezed or rolled or covered over by a weighted blanket. Other people might have a box of comforting items or have some other activities which they find comforting, for example, absorbing themselves in a special interest. Allocating worry time is a strategy that some parents find useful, maybe even timetabling it into that new routine to try and limit reassurance-seeking questions. So, for example, working with one young person, he keeps asking, when are we going back to, well, they're in another country, he keeps asking every day, when are we going back, when are we going back? And the parents just don't know. So trying to limit those sorts of questions is a good strategy. And also having a worry box is a nice sort of visual strategy for dealing with worries and just saying goodbye to them for younger or developmentally delayed children. So for those with an intellectual disability, an added challenge is explaining why certain changes have happened, why a person can't do the things they usually do, or see the people that they might want to see, etc. So there are some fantastic resources out there, and I'm going to try and share my screen just to show you, hopefully, that everyone will be able to see This is an example from the National Autistic Society of a social story. This one's about social distancing, and it's just a really nice visual way of explaining verbally and visually as well just certain facts. There's plenty of these on the National Autistic Society. So I'll just get back to that. Just minimize that. Okay. And the NSPCC has a really nice page on supporting children with special needs in the pandemic as well. So there may have been an increase in challenging behaviours during this period, but even so, it's really important to still seek help if needed. Most CAMS and behavioural support services are operating, albeit remotely, so talk to your GP about the best service to access if behaviour at home is posing more of a challenge than usual.
Great, thank you. Thank you, Annie. Okay, next question to Wahak in adult well-being, psychological well-being. This is a person who is saying that I was diagnosed post-traumatic stress disorder, PTSD, in the past, and have just been gradually recovering, and worried that if I feel or if I get another major trauma like contracting COVID-19, will I be permanently scarred or become disabled psychologically?
Okay. Yes. This is a good question. As I say, the main issue, the main mental health impact of coronavirus is anxiety. And anxiety could have impact on any mental illness. So people who had mental illness in the past or still who are suffering from any kind of mental illness could be impacted negatively by the anxiety created by COVID-19. PTSD is one of the cases. Some people, they may have more symptoms of PTSD. Some people who are recovered and go through a difficult period, like having the infection, etc., could have a relapse. But increased symptoms in any mental illness, including PTSD, is something expected in such circumstances. And increased symptoms does not mean that the person is in relapse. In this particular case, the person who said he or she is recovering from PTSD, but is fearful that he or she may have another trauma and that could have a relapse. There is another aspect to it. If the person is recovering, this could be a good test to go through to prove that the recovery is going on. Not every anxiety will lead to relapse. If the person continues the recovery planning and treatment, and think that this is a period of anxiety which everyone will suffer from it. I think it would be possible to go through and also to have more confidence and more reassurance that going through an anxiety period does not mean there will be a relapse of the illness. The contrary, it could be reassuring that the recovery process is going on well and the person can come out in a better mental state with more self-confidence and reassurance.
Good, thank you. Thank you so much. That was very sensible advice, yes, and there are so many people with post-traumatic stress disorder from previous episodes of disasters or crisis. Okay.
I may add something about what the person mentioned, permanently scarred and disabled me psychologically. I think it is not very helpful to talk about permanent scar. Permanent scar is something which I am not sure is related to such cases. We know psychological states sometimes could be chronic, long-lasting, but always there is a treatment, there is a recovery. So I don't think permanent scar will apply in this case. But what we need to think of, if there are more difficulties, then we need to seek help and sort it out.
Great, thank you, Vahag. Okay, next question to Annie. Annie, would you like to read your question?
Yes, so the question is, staying at home for a long time together with children increases the chance of child abuse and neglect because of strain, especially in a single parent family. Can you comment? And sadly, as you mentioned already, Seta, this is true. Calls to Childline have increased a great deal, as have calls to domestic violence helplines, which means that children are at greater risk of being exposed to abuse themselves, as well as witnessing violence to others. So, I mean, there are many individual factors in each household, which increase the risk of child abuse, such as social isolation, socioeconomic disadvantage, substance abuse, all of which may be abundant during this pandemic. And of course, school provides respite and normality for many young people in abusive situations who are experiencing neglect. So I think despite schools remaining open for vulnerable children, at one point I read that only 10% of those known were attending school at one stage. And we just don't have our usual support systems, such as grandparents, after-school clubs, monitoring by social services in place. I think local authorities are undertaking visits with certain risk assessment procedures in place, but they're doing what they can remotely as well. But as with everybody, is far from ideal. Particularly appointments via Zoom, I think, pose extra challenges for social workers. So reduced protective factors and increased risk factors was how the Department for Education's website describes the current situation. It is worrying, but we won't know the full extent of this until society opens up again and schools go back, I think.
Good. Great. Thank you. And Vahag, do you want to add complement what Annie said, or you are?
Thank you.
Okay, so we go to next question to you, Vahag. It says, I have negative emotions having negative emotions on surface and avoidance of help with potential risk of suicidal tendencies. How do you comment on those group of people? Or what advice will you addressing them?
Yeah. Before commenting, really, one thing which I don't know, what is the background of people who are asking such questions. What I mean by background, I mean from the mental health point of view. Have they had any mental health problems in the past or no? Is this new? Are these new symptoms or something they had and now they are going through it again because of the circumstances? But however, negative emotions, anxiety, low mood are symptoms which are expected a lot of people to complain of in such circumstances. These are reactions. In this case, avoidance of help is part of the negative emotions or the lack of desire to do anything. And also it is avoidance because of the anxiety. Anxiety what will happen, to be contaminated or to have the infection, etc. With potential risk of suicidal tendencies, here we are talking about something more serious. Suicidal tendencies means we have to ask if there is any element of depression. It's not only negative emotions. It could be a depression. And if there are real tendencies of to end the life, then I will advise the person to seek help as soon as possible. Depression could happen in pandemics. I may explain that later on. But suicidal tendencies, it is one of the signs of depression, but this is a serious sign. It means that the person needs help. The person needs to contact mental health professionals, have their idea, have a discussion with them to deal with the situation.
Excellent, thank you. However, some reports have shown that suicidal rates during crisis, it goes down. And then during recovery phase, then there will be a rush of people wanted to harm themselves or to ending their life. Hopefully this will not happen during this pandemic. Great, thank you so much. Thank you. Annie, the next question is question number 4. You want to get through?
Yep, so regarding children going back to school, the question is how to communicate with my 5-year-old child to remain health vigilant without causing distress and inducing a negative impact of schooling in the future. Something about school, sense of school rejection. But as with the first question above, it's how you deliver the information. There are some really nice resources out there, including some really well-written visual stories. I was directed to a website called ELSA, E-L-S-A support, in fact, which I'm going to share my screen again and show people because it's such a nice story. So let me just do this really quickly. So it was this one, I think. Share. Hang on. So I hope people can see that. So back to school. So it's really nice. It's talking about how brilliantly children have all played a part in, you know, staying apart, obeying the rules, washing your hands, you know, that sort of thing, and how, look, things are much better. It's just a really nice visual way of explaining it, normalizing it, and then just talking about carrying on, follow the rules. And it's left it blank there because I think, you know, first of all, the rules keep changing, and also different schools might have slightly different rules. So I'll just stop sharing that. So that's on the ELSA website. Let me just minimize that again. And that. And so there is a lot of confusion. Not all children are going back. That's one difficulty, explaining to children why they're going back if their friends aren't, and vice versa. I think it's just going to be really important, again, to normalise feelings of confusion, but just to emphasise that the coronavirus situation is much better now. There are rules in place to keep us safe. The risks are very low. I think, you know, some parents will make the decision not to send their children back, and that's okay too, of course. So I think it's really about just explaining whatever you decide, but in a really calm way. Just keep your language fairly neutral, tone of voice fairly neutral, etc. And I mentioned that I work with neurodiverse children, including autistic children. And I think the return to school here may be particularly challenging. As I mentioned, the fact that being at home is actually very stress reducing for many children with autism. So explaining that they need to go back might be tricky. But again, I think this is a real opportunity for change as well, actually. I mean, for a long time, I've been banging a bit of a drum about how traumatizing regular sort of mainstream education can be for children with autism, with or without an EHCP. And I think this is a real opportunity to try and change the way we deliver education, actually, for children with autism. You know, maybe there's an option for online teaching or a mix of online teaching and actual attendance, that sort of thing. I think we have to think a little creatively here.
Great,
yeah. Okay.
Great, thank you. Thank you. Okay, we talked about anxiety, which is the main factor during this sort of crisis or pandemics. Vahak, would you like to comment on depression and what's happened to the depressive people during this pandemic situation?
Yes. Depression is one of the mental health problems known in pandemics. And depression could happen because of the direct effect of the virus on the brain. We know that there is another vague of depression could happen, which is called post-infection depression. A lot of people who suffer from virus infection can have a depression after they are recovered from the virus, but also depression is related to the circumstances which accompany such pandemics. And that includes the change in the lifestyle, the change in the activities, the social contact, isolation. Also, it includes loss of loved ones, loss of a job, or
Oh.
Voice disappeared.
Oh.
It looks like that we have lost Vahak here.
Oh dear.
Okay, we perhaps carry on. We carry on with Annie next.
Yeah.
Yes, we carry on with Annie until Vahak sort out his connection.
Okay.
Annie, can you take the next question?
Yes. Calls to child helpline.
Child helpline, yes, please.
Yeah. Okay. So for children seeking help, that calls to childline have gone up by slightly older children as well. How can we make sure that our upbringing is safe to protect our children from imminent scarring of future adult life? So I think that at each stage of development, this pandemic is affecting young people in different ways, actually. So as I mentioned, younger children may have a lack of context of prior knowledge with which to make sense of this situation. But with older children, there may be many other factors at play, such as disruption to their education, missing out on key events such as graduations and proms. For young adults, maybe anxiety around further education, missing out on social opportunities such as friendships made through studying or living together, reduced travel opportunities. So we have to be mindful that all these concerns are very valid, even in the face of disruption to health and livelihoods. And so with regards to lasting effects, we just don't know yet how this is going to affect both individuals and all of us collectively at societal level. So people are speculating about increased rates of OCD, for example, suicide we've mentioned already. So promoting resilience, I think, is going to be key here. So being aware that parental anxiety is one of the biggest risk factors for childhood anxiety. So it's really important that parents look after themselves so that they're in a place to look after their children as well. I think a lot of children are actually doing really well. They're doing much better than we might have anticipated. Children can be really resilient, and also, younger generations have really trailblazed in terms of, for example, raising awareness about the environment. And nobody can have failed to notice in this pandemic that the improvements in air quality, noise pollution, that sort of stuff. So, it means that young people find replacement activities for those that they're missing out on somehow. I don't know. So we'll talk a bit about social media in a bit as well, which is really important here. Do we have Vahak back yet?
It looks like not.
No. Okay. Shall I go on to talk about social media?
I think so. I think if we carry on, Annie, if you then take that next question of yours, and then when Vahak comes back, then we will continue his questions.
Sure. Okay. The next question, which follows on really, so it's by children's various authorities' advice, health and social authority, we should be very careful and observant and be very conscious about the time our children are spending on screen. But in the last 2 months, digital activity and screen activity went up. And also to combat isolation, especially vulnerable, shielding parents, how do we sort of manage the use of social media? Is there a limitation? this is for both me and Vahag. So from my point of view, so this has been a major challenge for all the parents that I'm working with, and in fact all the parents I know personally, which is how to entertain bored and disappointed children stuck at home, and also how to police screen use when so much teaching is online at the moment. So most of the parents I know have really relaxed their rules around screen use, partly because they themselves have had to get on with work, and there are simply very few alternatives to screen time when you're at home with kids. However, they have made it very clear that the change is temporary, and in fact many parents are also beginning to recover some control over screen time actually. So one family that I know have a screen-free day once a week, which is working really well. And the key is keeping in place some boundaries while I think maintaining your own sanity really. So, and interestingly, after the sort of initial flurry of Zoom calls, house party calls, etc., quite a few of the young people that I work with actually rejected social media themselves, or at least limited it of their own accord, whereas some of them, of course, are still very dependent on it. So it is important to remember that social contacts are so incredibly important for teenagers in particular, but just remind them that it doesn't have to be 24/7, I think. So really difficult, it's really important to maintain some sort of balance, but I think gradually we do have to think about getting back to reasonable screen time use.
And you think that it is okay if they allow them to play games on their, especially those under age of 9 or 10, young children, to play games on their computers or their tablets or whatever they've given, so that they don't reject the homeworks or studies. It's not only tablet associated with homeworks.
It's really hard, isn't it? I mean, I don't think many parents have much choice, unfortunately, but I know that some teachers or some schools have got some sort of app or webcam or something, so they know what the children are up to. So for children who have been sort of slightly sneaky using a screen to play a game or something, teachers are on it.
Yes.
Which is good. But I think for parents, it's really tricky. I mean, you know, switching off Wi-Fi at night is an option, obviously, but you know, then you can get rages, and for children who are stuck at home with not much to do, I really think every family has to find their own balance.
Yes, I think the balance is important. To reward them with games. On the other hand, to encourage them to do their work on, because everything after this pandemic will become digitalized, will become remote, electronic. So they have to be prepared for that. Yes.
I mean, even myself, you know, we're all on computers all day, every day. It's tiring.
Yes.
And it can affect just your general well-being. So getting out for exercise, sometimes though with teenagers, it can be difficult to motivate them. It's Vahag back.
Okay. Yes, that's great. Vahag, are you back? Vahag, are you back now? We can't hear you. No voice, we can't hear you. Unmute your.
Now, can you hear me?
Yes, I can. We can hear you. Okay, great.
Sorry for that. It was an internet problem.
Okay, all right, Vahag. While you were,
I was talking about depression. Can I continue?
Yes, of course. Yes.
As I said, depression can happen in pandemics, but the issue is whether the person needs to seek help or not. It depends upon the degree of the symptoms, because only feeling low does not mean depression. If someone really feeling low, he stops the activities, he's not enjoying life anymore, and started to have some self-harming or life-ending thoughts, then it means the issue is more serious and need to seek help. So therefore, it is also important to differentiate between anxiety, which is just feeling anxious, or feeling low in mood, which is due to the circumstances, or really depression, which as I explained, it has more serious symptoms. In these cases, if the patient is, or if the patient had depression in the past and still on medication, the person should continue with the medication. should continue with all the daily routines and activities and apply all the strategies which helped in the past, and if necessary, seek for help, contact the mental health professionals. But if this is something new and there are signs of all the symptoms of depression, then asking for help is something important. We should not hesitate in asking help when it is needed. That is very, very important. But in general, depression is not something rare and not something exceptional in pandemics.
Excellent. Thank you. Thank you so much. That is very clear.
Pleasure.
Thank you. Now, the next question, which will, Annie, do you want to start reading the question, number 7? And you could both chip in or both answer according to your own merits.
Number 7?
Yes. Children have social authorities advise.
Yeah, I've done that one.
Oh, we did that one. Sorry. Yeah. Yes, we did that one. Yes. No, the one with the cough. Parents with a cough. Yes, this is the children. With children, sometimes they present with physical symptoms. Physical symptoms, which is not quite clear whether it is a genuine physical symptom or it's they mimicking what the member of their family or their closest has been experienced recently. What's your comment about that, Anne? Is a child with presented with cough, and he was isolated with the parents because both parents had COVID-19 and they were coughing all the time and they were worried. Yes. So the cough, although it was on and off, it was not serious cough. There is no short of breath, no wheeziness, nothing.
Right.
So how do you explain these children mimicking their nearest and closest?
Yeah, it's not something I've come across commonly. I mean, you know, imitation is a very typical child behaviour. So it is possible that somehow the child was either empathizing and just started imitating the behaviour through sort of empathic response. It's not a typical sign of anxiety or anything like that. It may be, who knows? And then it's also could be associated with a tic as well. So I think with anything that's kind of sort of physical, could be physical in origin, of course you have to rule out any medical cause. But if it's a medically unexplained symptom, then one would want to look for psychological factors, such as I say, sort of anxiety or empathy or something like that. But not one that I've come across myself.
Mm.
Yes.
Okay. Good.
I would agree with Annie. Really, it could be physical or it could be psychological. So my advice to the parents is to take it seriously. Try to exclude any physical cause, and if that is excluded, then we need to explain to the child. But even if, let us assume that the child has any physical cause for it, including coronavirus, then we need to explain to the child in a way that the child is able to understand. One of the possibilities is that the child is anxious about the parents because they are coughing. So the child is trying to express herself through mimicking the same symptom, or just trying to send a message that I don't feel well. So talking to the child, asking what she is occupied with, if there is something not going well, or any worries or any anxieties, etc. All that will help to clarify the situation, and then explain to the child in a simple way that these are circumstances where people could get the virus, but the majority of people will recover. And we know that you are worried about your parents, but a lot of people did well, etc., etc. So reassure the child. But we have to consider both aspects, physical and psychological.
Great, thank you so much. Thank you. There are two more questions, which is usually, it's a common question, which I think I will be able to answer this, unless if you want to complement my answer. One of them is saying that I was on antidepressant before the lockdown, although I'm feeling better, but not sure whether this is a correct management now, and I am still not 100%. What shall I do? The answer to this question, I would say to that person that if you have started taking medication for your depression, I think that you have thorough assessment by your doctor before prescribing you this medication, perhaps 2 months ago. And we normally assess the patients 3 weeks after starting medication, but because you were locked down, you couldn't attend for your 3 weeks follow-up review, and now a month or 2 months later, I strongly suggest that you ring your GP and go through the clinical assessment, where you can do it electronically on computer remote or on video or online. But if you try not, if you like not to go through remotely, you want to see somebody face to face, we are now GPs in the practice where we're accepting patients to see face to face, especially for mental health or depressed or anxious patients. We are well aware that so many issues on mental health or an anxiety or depression cannot be sorted out remotely on Skype or on telephone. So please make an appointment and have a review, and then see whether this medication, if it is not good for you, then you change it, or if it is okay, you're happy with it, then you will continue. You should continue until at the time where you agree with your doctor to stop it, or see what sort of therapy you will be adding to. Okay, and then another question again, do you want to add anything, or are you okay with this, Bahag?
Really, I would agree with you. Just I want to say that a golden standard in such circumstances to all people, whether complaining of physical or mental health, is to continue the same treatment, is to stick to the treatment. Don't try to change it or to stop it without medical advice. In addition, in case of antidepressant or in case of depression, there are other measures which the person should continue doing, as keeping the daily routine, the daily activities, exercise, social contact, etc. All the things. I know some of these are difficult to practice in some circumstances, but always people can find something to do which can help their depression and can help their mental well-being.
Good, thank you, thank you. And there is one question from the participant. Annie, would you like to read it, that question?
Yeah, thank you. I think in many countries, people are made to wear masks, though in some countries it's too hot. What do you think about wearing masks? Thanks a lot.
Well, this is a very interesting and very controversial, has come up with so many times in so many questions and answer session and so many places. Wearing mask is, if you are in open air, if you are in an area where you know that there is a good social distancing and in your familiar environment, then wearing mask, it's may not be necessary. However, if you're going to supermarket or you're going to congested places where there are, or in the underground or train or buses where there are so many people coming in contact with each other, there is no harm to wear mask temporarily for that period where you are in a crowd. However, it's sometimes very difficult to wear mask and manipulating mask, wearing it, taking it off, and touching it with your fingers. So it has some small drawback in that regard. And also, funny enough, it's difficult to communicate, to talk. So if somebody is having hearing difficulties or children with hearing difficulties or not able to, they can't see your lips, they don't know what you're saying. So it is extremely difficult. You have to adapt yourself and also try to make your own masks if you can, not to deprive the health professionals from the availability of the mask, which is needed mostly. Yes, I personally wear mask if I go to shops or if I'm coming in very close contact with people. However, most of the time when I'm walking in the park or in the streets where there are not many people, fresh air, there's no need to wear masks. All right, agree with me?
Yeah, I agree. I would like to add wearing mask during exercise. If we are exercising or in any physical exercise outside in a fresh air, we have to be careful about wearing mask because it can have some impact upon respiration. So we have to be sure that we are doing it in a place where there are not a lot of people. We are keeping the distance with the people, but we do our exercise without wearing mask.
Excellent. Yes. Thank you. Thanks, Bahag. Now, there's the last question we have received that Elsa, this is again for me, unless if you are happy to answer. It's saying that I'm confused in this COVID-19. I don't know in this emergency situation, if I develop symptom or something happened, what shall I do? There are so many numbers now published or in the media or in TV, either 111, 119 or 999. So where shall I go? Okay, to clarify this, this is very important everybody to know. If you have nowadays every sign or symptom person experiences, we consider that this could be COVID until proved otherwise. If it is new sign of symptoms, if it is existing, we had it for a long time, your back pain, yes, that's not what I'm talking about. But any new symptoms or signs you see we've been saying in the last couple of months that can be considered that it is COVID-19 until proved otherwise. In your pre-existing problems, say like for example you had back pain or hip pain for years and years and now it's flare up, that could be your pre-existing problem. In that situation, if you want to get hold of somebody, you can either ring your GP during daytime, which now they are open, they are all welcoming patients and the service is back to normal, or out of hours times, you can ring 111. I insist it's 111, ordinary 111. However, if you think that your symptoms or something you're getting, which is absolutely new, you don't know what it is, and you're worried it might be COVID, in that case, you ring 111, but you go into COVID services. There is an extension from 111 which says COVID services. So you dial that number of COVID services. So this is in regard to 111. However, if you are having problem which is life-threatening, like very difficulty in breathing or severe chest pain, which it could be a sign of early heart attack or sweating or confusion or collapse or diabetic sort of ketoacidotic type, breathing heavily or diabetic coma or anything like that, is the best thing is to ring 999. It's the usual blue light emergency which can attend within 7 minutes or sometimes even less. Now, recently we introduced, or government introduced, another service which called 119, And this 119, it's only for those people who wants to have COVID-19 test done. And now everybody is eligible or can have COVID-19 test if they want to. So if you want to have tested to reassure yourself to get psychologically better that you are not exposed to virus, although being negative is not 100% specific and sensitive, but if you want to be tested, you just ring 119 and register, or you go on nhs.gov/COVID-19/get tested website and register and get your postcode in to see where is your nearest mobile drive-through center. You can go there and have it tested, or you can request test kit to come to you at house and you do it yourself. Okay, so this is a 119 line. However, just recently also we in general practice introduce antibody testing to see whether people would like to know whether they have antibody, whether they have had the virus, exposed to virus before. So that service now, just I think from next week, or they have already started some GP practices taking pilot site and going to roll out in all the country practices. They have the test. So if you are a key worker, or if you're worried, you want to know whether you have got antibody, you can almost request to have that antibody test done as well, especially if you are due to have a blood test for some other reason, like cholesterol or kidney function. You can say, oh yeah, by the way, could you add me to have antibody testing as well? So that service is also available and will become widely available from next week onwards. Okay, and I hope this is clear too. And the services in general practice is back to normal. So please don't sit there with your symptoms. Don't be terrified, and it's all be well organized and get your normal reviews and repeat medications time as before. Okay. Anything you'd like to add, Vahag?
No, thank you, Seta, but I think this was the last question. If we have some more few minutes, really I wanted to give a very brief idea about the well-being during such epidemic.
Okay. Do you have how many minutes have you have?
Just 5 minutes if
okay.
Yeah.
Okay.
Really, as I said in the beginning, fear, worries, and anxiety are the main mental issues which can impact population. These, the anxiety in general can impact population, the whole population, but also it can have some more specific effect on older adults, care providers, and people with underlying health problem, whether physical or mental. Of course, it is, we can understand why population get worried, because first of all, because they are concerned about their health, because of the isolation, change in the lifestyle, the uncertainty, what is going to happen, economic concerns about the loved ones, etc., etc. Older adults have particular situation because older adults, a good number of them, they are they live an isolated or relatively isolated life, so they will be more impacted by the measures. They will be worried whether they will be able to get help or not, and they will be worried more about their health and what will happen. Regarding the care providers, they are in daily contact with people infected by the virus, so usually they will be worried about themselves, about the patients, and also they need to deal with the family of the patients, and some of them even they may burn out from the daily stress that they face. People with underlying health conditions, For example, people with mental health conditions, they will have, of course, more anxiety, more low mood. There could be worsening of already existing symptoms. They could have a relapse in their mental illness, and also they will worry about the availability of their medication, the accessibility to care system. They may suffer from more isolation, of course, lack of activities and exercise. All that will have more impact on the mental health. People with physical health symptoms, also they will, some of them, they will neglect their health. They will avoid going to their routine appointments with their health professionals, so they may deteriorate in their physical health, and this may add more difficulties to already existing difficulties. They may worry about the availability of help, how to contact, who to contact, and what to do. So all these are impacts upon such people. In addition, I would like to mention something else. Due to the isolation, due to the worries or low mood or lack of activities, people may feel that they need to self-medicate. And the first self-medication will be the alcohol. And this will add more problems to the already existing difficulties, will make the situation more complex. Some people even may try illicit drugs, and these may lead to more self-harming behavior and suicidal behavior. So in order to deal with all of these, there are very simple measures. First of all, keep the daily routine as far as possible. Try to do the same activities that you used to do in the past. And if it is not possible, think of new activities at home. And these could be very simple things. It could be singing, listening music, drawing, exercise at home, cooking, etc. Second thing, keep your social contact as far as you can. And of course, here it will not be physical contact. Mostly it will be through telephones, social media, or other means which are possible. The other issue is it is important to know how to get help needed and when to contact the authorities. Other issue is to use techniques that helped in the past, whether it was exercise or any self-helping techniques or meditation, gardening, relaxation, anything which helped in the past, to use them again and again in order to have a structured day. Having a structured day is a very important and essential activity that helps us to deal with such circumstances. The other important issue, don't try to increase the alcohol use, and try to stick to the healthy food. As people, sometimes they don't have anything to do, so they start to eat more, which is not something helpful, and try to do what they used to enjoy. The last thing possibly I would like to say is avoid sticking or listening to the news all the time, and try to get the news from the authorities and avoid any situation which make you feel more anxious. And thank you.
Thank you, Vahag. We just received one more question, which Annie, would you like to read and see whether we can answer?
Yeah, one for you again, probably. What advice would you give to people with underlying physical conditions who are worried about going back to work and lack of adequate social distancing in the office?
Okay, this is a very good question. It's very important to whoever has got underlying medical problem in this pandemic situation for any sort of job, whether it is healthcare sectors or in their own environment when there is not enough protection, to declare to have a quiet chat with their boss, with their supervisors, with their employer, and come up with sensible plan of action. If that person has got facilities or any way where they could work from home, or they could work from some remote situation, or from quieter room when there is not many people around, it is the arrangement they should come together with their employer. But most of the employers now, they are very, very understandable in this sort of scenarios where there is underlying health issues. So be frank with your employer or with your managers or employing authorities, and I am sure we'll come up with sensible way of working arrangements. You can adapt your work hours, you can adapt working from home or any sort of situation which suits you, but you have to declare very clearly and be open about your physical health when you are exposed to working atmosphere. Okay, is that happy? All right?
Yes.
Okay, I think we're coming to the end of our webinar. We're concluding here. I would like to thank our panels, Dr. Anya Osvajian and Dr. Vahag Davitian. Thank you, all of you who joining us today and participating, and thank you for your questions. We are gratefully, I'm greatly appreciate if you could provide us feedback, which help us tremendously to organize a setting of those educational webinars or educational live events in the future. Now, special thanks, as usual, to Armand and to Kurken for technical support, providing us technical support, and thank you for ACEMC, Emergency Community, Armenian Community Emergency Medical Team, who hosting us those webinars.